On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, Evaluate to Improve. My name is Joanne Atkins, and I will be your moderator for this program. Now I'd like to introduce our speaker for the webinar. David Stefanik is the Regional Readiness Coordinator for the Northeast Healthcare Coalition. In this role, he supports Pennsylvania hospitals, healthcare facilities, and regional healthcare coalitions, and provides regional collaboration, preparedness, and response by encouraging the development and sustainment of healthcare coalitions. David has served in healthcare for over 15 years and continually seeks solutions to strengthen preparedness with our healthcare community and ESF8 partners. David, I will now turn the program over to you.
Thank you, Joanne, and thank you everyone for jumping on. Again, my name is Dave Stefanik. I have the luxury of overseeing the Healthcare Coalition for the Northeast, and I'm fortunate enough to have met a lot of our post-acute LTC partners within the coalition, so I am appreciative of your time, knowing you have a little of it. So we're going to get right into it. Today, we are going to be talking about sort of the improvement process when it comes to exercises. This is one of the more important steps for many reasons, and this is sort of the final step in the overall emergency management program and exercise cycle. So we're going to talk a little bit about that. We're going to look at the after action meeting and the importance of that session that takes place following an exercise. We're going to be looking at the components of the improvement plan, which is a really important elements of the exercise cycle. And then we're going to look at tracking that improvement plan and how we implement corrective actions. And then looking at what the value of it is and why we're here and what is the point of all this. So those are some of our objectives for today. So really, when you look at after action improvement planning, this is part of the exercise cycle. If you're familiar with the HCEP standard, that's something that people mention when it comes to running exercises. It's the Homeland Security Exercise and Evaluation Program. And you can Google that, and there's a lot of guidance and documentation related to running exercises. The after action improvement planning process is one of the final stages in the preparedness cycle. So when you're looking at your emergency management program and you're developing your policies, your procedures, your protocols, you're looking at training your staff, you're looking at implementing equipment, you're looking at purchasing supplies. How do we make sure all that stuff is valuable? How do we make sure it works? How do we make sure what we're doing is correct? How do we make sure what we're doing is safe for our residents, our staff, and the visitors that are in there? The only way you can do that is by exercising. Exercising is a test of all those processes and protocols and equipment and things that you've done in your organization to make sure it works. Exercises is a huge undertaking. The after action improvement planning process is one of the most important aspects because this is where you identify those lessons learned so that you can make changes to make sure that those plans, protocols make sense. Do we need to change them? To also make sure that we have the right equipment. So this is the final stage in the process, but understand this is a continuous cycle. So it's one big closed loop. So after you've done your exercise and you've created your after action improvement plan, you go right back to the drawing board and you do everything again. You make sure those processes, plans, procedures are working. Make sure that training that you're doing for your staff makes sense. It's a continuous cycle. It never ends. It's one of those things that you'll constantly be doing, and especially when it comes to improvement, it's the only way you can do that. And really, it's testing your capabilities, accomplishing your missions, the functions and objectives that you have within your exercise to make sure that if you have an objective of testing staff response to a resident evacuation, making sure that you're looking at your capability as a facility. And that's really what the exercise is for, and identifying things in the after action improvement plan. And the evaluation is really important. It has your objectives and your priorities. An example would be looking at a resident who went missing. If you have an exercise where you're testing that function, You want to make sure that the objective makes sense. You want to make sure that the priorities listed within that objective and identifying that lost or missing resident makes sense. And you want to look at capability targets and critical tasks. So, for example, if you have that missing resident, if one of your tasks is for staff to immediately call 911 or call the police, you want to make sure that they're testing that process in the exercise. One of those critical tasks could be calling 911, it could be pulling an alarm, it could be doing an overhead announcement. Those critical tasks are all things that you identify in the exercise based on your current plans and procedures. And then you're looking at your strengths and areas for improvement. This is probably one of the most important aspects of the evaluation. What did you do well, and what did you do that wasn't so well? And it's okay to fail. The exercises are meant for you to fail, and they're meant for you to identify those areas for improvement so that you can always look at improving your facility and your organization. And again, this goes back to keeping your residents, your staff, and your visitors safe. So you're always identifying those strengths and weaknesses. So what is the purpose of the improvement plan? The after action report, which is something we're going to look at in a little bit here, it really is a document that summarizes the information from your exercise. So as you're evaluating your exercise and you go through the actual the exercise components, essentially what you're doing is you're taking those key findings, you're using information that you observed, individuals who were evaluating the exercise, maybe some lessons learned that were provided in a form document, a survey. You're taking all of that and you're building out a report. It's looking at some of the core capabilities. So the capabilities of the facility and some of those emergency management aspects, whether it's communication, whether it's a response. So the after action report is a document that you're going to develop following the exercise, which includes your improvement plan. The after action and the IP are one of the most important things that we're going to talk towards the end of this session as to why they are valuable. And mentioned here, the IP, the improvement plan, is used for resolving corrective actions, which is probably one of the most important things. And really the point of running the exercise is to identify and improve upon those corrective actions. So this is the exercise cycle. Running an exercise can be almost a job in itself. It is a quite a big undertaking. Like I mentioned before, don't think of it as I need to run this gigantic FEMA exercise with 30 agencies and there's going to be 50 objectives. Depending on the size of your facility, you're basically going to test. You're going to identify what you're testing, whether it's a plan or a process or a protocol. And you develop that exercise based on the size and scope of that of your facility and the scenario you're using. So you can be using an example of a missing resident and create an exercise around that. You could do an exercise around an armed intruder. So as you can see here on the slide, there's sort of 4 elements to actual exercise cycle. One of them is designing and development, then actually running the exercise, and then the evaluation piece, using your exercise evaluation guides and any observations that you collect. And then there's the improvement planning process, which is probably one of the most important aspects. And again, this is looking at those items that you need improvement on, the items that you need to track, and the items that you want to make sure are resolved. So this is a continuous cycle. A lot of our regulatory requirements need us to run exercises every year. Most of you might be aware of that. So this is an endless cycle that continues on and on every year. So the after action meeting. Once you complete your exercise, about a week or so later, and that's give or take, that's a standard. However, that's not the rule. You can run the after action meeting a few weeks later. It's really going to be based on your availability and the participants in the exercise. And you're trying to get folks that were involved. You want to look at your senior leaders. They're probably one of the most important people. Without your senior leader buy-in, a lot of this stuff really becomes difficult, especially when it comes to your corrective actions. You want to get your emergency management team. That might not be a team. That might be one person. And for my folks in my coalition who are in the post-acute long-term care realm, it's the other duties assigned, and you look at your job description, and emergency management could be that. So if you have an emergency management designee, you definitely want to make sure they're involved. However, That could be somebody else who is also running that as the other duties assigned. You want to bring in your planning team. If you have an exercise planning team, you want to bring in your clinical leadership, maybe individuals that are involved with the budget, somebody that might be involved in strategic planning. You want to bring in your quality improvement folks, your infection prevention people, if this is around infection prevention scenario. And you want to make sure you bring in your patient safety folks or your resident safety folks. They are hugely involved and they're sort of a partner when it comes to doing emergency management. And there's no rule for how long this meeting should take, usually about an hour or so. You go in and you collect all of the data from the exercise, your observations, your surveys, your participant feedback forms, your exercise evaluation guides, and you bring all that to this meeting and you look at the results, you look at the key findings, and you look at what went well, what went wrong, what were we supposed to do, did we accomplish the objectives that were in the exercise? How did we do with our critical tasks? And you're going to look at the areas that you need improvement upon. And I'll go back to the missing resident as a great example. The missing resident, step one of the missing resident policy is that the clinical charge nurse has to call 911. That's one of the things, if that individual did not call 911, that's going to be one of your corrective action items that you're going to include in your report. If the other example would be if your missing resident policy describes that you hit an alarm that's under your computer and that alarm fails, that's a corrective action item that you want to add. And also, too, it's important, look at what you did well. All too often we beat ourselves up and it's all about the negative and what went wrong and we failed. Make sure that you're identifying those lessons learned and the things that you did well and be able to provide positive feedback to your staff and the individuals that were in the exercise. We're in a tough times, and I think any good news is better, and trying to make sure our staff understand that we appreciate what they do. So understand that strengths are just as important as the areas for opportunity. And this is an example of what the improvement plan will look like in your after action document. So this is part of the what we call HCEP standard. When you go online and you look for the HCEP documentation, this improvement plan matrix is sort of the standard that you follow when you're building your improvement plan process. And you can see a lot of this is self-explanatory. You're going to look at what capability you've tested, the observation that you found. Observation one would be the nurse or the clinical charge individual did not call 911. That would be the observation. And then looking at your recommendations. What do we need to do? We need to improve our training on this. We need to make sure people review the policy. Whatever that recommendation is, this is where you're going to discuss that in your after action meeting. And then the corrective action description. And we're going to talk a little bit about SMART corrective actions in a slide or two. But this is where you want to make sure you identify the information that you're going to basically do to improve upon it. And then the elements, when you pull up your improvement plan matrix, there's actually a section that talks about whether it's planning, whether it's training, whether it's equipment. And it just gives you an idea of what that category is that corrective action falls into. And then your primary responsible agency, whether it's the facility, whether it's an individual, whether it's an external partner, maybe it's an IT group that is outsourced, maybe it's your dietary department that is outsourced. You want to make sure you identify who is responsible for that corrective action and that point of contact. And then your start and your end date are important. Your start date usually occurs probably right around the time that your after action meeting has been completed. And then your completion date is something you really want to pay attention to. And we're going to talk about tracking corrective actions in a little bit, but your completion date is important. It gives you and your senior leaders and your staff involved a sense of where you stand with your corrective actions and whether they're completed or not. And then tracking implementation. This is probably one of the most important parts. So when you build your after action document and you complete your improvement plan matrix and you've had your after action meeting and you have now a living, breathing document that you're going to use as a roadmap, you want to make sure you continually capture information related to the tracking of these corrective actions. And this is really important because it's really the right thing to do for your organization. It's the right thing to do for your staff, your residents, your visitors. But it also is a regulatory thing that you need to be careful of. Our individuals that come in and do our regulatory surveys, they will sometimes look at these after action reports and they will look at your improvement plans and they will say, hey, what are you doing to correct this? Having a neat and organized and up-to-date tracking matrix is a great thing to have. It's something that you can hand off to the surveyor and say, yeah, this is what we're doing. This is what we've done so far. And this is where we intend on being, and making sure that you're continually following your tracking and improvement process. Some of you may have a patient safety committee. Some of you may have an emergency management committee or a safety committee. These are great places to add a item into your agenda and have just some frequency where you can bring your improvement plan to that meeting and say, hey, this is where we're at, and I need some assistance in this. You can't do it on your own. Understand that this involves multiple partners. It involves sometimes external agencies, other departments. This is a team effort. You as an individual cannot do this all on your own, which is why I mentioned earlier in this presentation that your senior leadership have to have buy-in, and not even just for implementing corrective actions, but there could be a financial cost to what you've done or what you've identified. I'm going to use an easy example of, let's say you were doing an evacuation with a simulated fire. And when you pull the fire alarm in your facility, the alarm system fails, which is not good. That's a life safety issue that you need to correct immediately. That may cost some money, and it might be something that you just can't resolve right away. So making sure that senior leadership is aware of the exercise, making sure they're aware of the areas that you identified, making sure that they are involved in the improvement planning process, making sure that they have up-to-date information as to what you foresee there being an issue. Your maintenance personnel are going to become your best friends. A lot of things that go on in facilities are utility related, some of the higher risk issues. So make sure that you are involving them as well. And it's really a way to kind of justify some of the things that you've already done, making sure your policies are in place, making sure that systems work, making sure that equipment that you purchased are valuable. If you do an evacuation exercise and your stair chairs, they aren't working as intended, that could be a justification that you need another stair chair or you need another piece of equipment to evacuate those residents. And something that I really want to stress here is smart corrective actions. When you're doing a corrective action, you don't want to just keep it simple. You don't want to say train the nurse on how to implement a resident missing resident procedure. You want to have sort of this specific, measurable, achievable, relevant, and time-bound process. We are going to make sure that we train on this specific process by this time. The training is going to be this long. Our audience is going to be this. And you want to make sure it's something that you can track and follow. And your quality people love that. They love it when you have data that you can follow. And your surveyors from a survey side like that as well. So make sure that you are keeping your corrective actions smart. You don't want to keep them simple. You want to be able to follow that and have something that's sort of specific, measurable, achievable, relevant, and time bound. And then what's the value? The most important thing here is that you kind of owe it to your staff, you owe it to your residents, your patients, and the visitors to make sure they're safe. If you have a fire alarm system that doesn't work, that is a huge life safety problem. And you can imagine if you had a real fire in your facility and that system failed to operate and you didn't test it. Can you imagine just how horrible that could be? So at the end of the day, these exercises are based on keeping people safe, making sure these procedures and processes work. You look at what's been going on around the country. We've had a pandemic for the last 2 years. We've had hurricanes in various parts of the country. We just had Ida come through. Those post-acute partners in Florida, they are the most vulnerable when it comes to that. Armed intruder is another one. So that's another exercise that you can run where you want to make sure that your staff and your residents understand what that response looks like. And these are great ways for you to test your partnerships with your external partners, whether it's your fire, your police, your emergency medical services, your healthcare coalition, your local emergency management agency. So this is a not just for your facility, but it's really for them as well to make sure they understand the importance. And then looking at some of these other values, your employee buy-in. I find that with exercises, sometimes it's a chore, but employees, I think, really get into it if you can run a great exercise and they kind of can buy in and understand, like, wow, I'm not doing this because I'm required to be here. Like, this is important for my residents that I'm taking care of. And there's some other values, returning back into service quicker. If you're looking at, you have a fire and you've run through an exercise multiple times and you're able to improve better every time, you get back to service faster. You have fewer resources and time needed to address an issue. So sometimes it may not be all about buying the most expensive piece of equipment. Sometimes it's just changing a protocol, and you can save yourself money by identifying that in the improvement planning process. And then lastly, and I have this here, and it is important, but it shouldn't be the most important, the regulatory requirement. Having an improvement planning process is a requirement. You have to be able to show that you've identified and you are tracking and improving on these corrective actions from the exercise. So it is hugely important. Um, Again, this is a huge undertaking, but I just want to stress that in terms of your emergency management program and running an exercise, this has, to me, the most value. You can't get better without finding those areas for opportunity. And I want to stress that it is okay to fail. The point is to push yourself to make sure that you identify those failure points. Um, it's not easy. Exercises can require a lot of time. Improvement planning process does require a lot of time. I encourage you to get involved with your healthcare coalitions. We can help you with some of these things. There's a lot of external partners. Your local emergency management agencies can offer a lot of guidance. And there's a lot of people that are really eat, breathe, and drink this stuff that can help you. So knowing that some of you have this as your other duties assigned, just understand you're not alone. Please reach out, and folks can help you and guide you along. This is a really important piece, and we don't want to undervalue how this really affects you and your staff and your residents. So I am going to turn this back over to Joanne. I appreciate everybody's listening to me, and if you have any questions, I will be on.
Thanks, David. That concludes the slide presentation portion of our program. Now we would like to begin our question and answer period. If you have questions, please type them in the Q&A box found at the bottom of your screen. Please click on the three dots, then click Q&A to open the Q&A panel and direct your questions to all panelists. We will try to answer as many questions as we can. David, there is one question that has come in. What gaps do you typically see in after-action improvement planning?
Yeah, so there is a sort of this interesting statement, and it's not just long-term care, it's a lot of exercises. One of the number one things that fail is communications, whether it's an actual piece of equipment or it's just a process that fails. For some reason, communications, it always seems to be that one gap where it just we can never close it, whether somebody doesn't get notified or somebody misses a message or a notification. So you want to make sure that when you're adding a capability to test your communications. If you have an exercise that's testing armed intruder, doesn't matter if it's a fire, evacuation, there should always be a communication component that you're testing. That's one of the number one things that fails.
Thank you. Another question has come in. How many team members do you usually have on your emergency preparedness team?
Well, that's really going to be based on the size of your facility. If you're a large facility, you should have some senior leader. You can have your emergency management designee, patient safety, quality improvement, your maintenance personnel. You can go as far as your dietary folks. Emergency management touches everybody and every department. It is really going to be entirely up to the size of your facility and the time that folks have to be involved. I say the more the merrier because I'll use dietary. You may have an exercise where you're testing your ability to supply food in a 96-hour sustainment. Let's say you have a simulated hurricane and your food providers say, I can't get food to you for 3 or 4 days. Your dietary people play a huge role in that. And that's a part of your emergency management program. So it's really going to be dependent upon the size of your facility. But I always say the more the merrier.
Thank you, David. That was very interesting bringing up the dietary department because I'm sure there is a lot of people, myself included, who did not think, what if we couldn't get food resources?
Right.
Um, and then one other question came in. How many members of the team should there be to participate in your after action planning meeting?
So it's gonna kind of be again dependent upon your facility. I would definitely have a senior leader involved because a lot of the things that you want to implement may require their buy-in. Some of the other folks that could be involved would be anybody that's been involved in your exercise planning team. So if you have a few folks that were involved, bring them in. You may have a individual who's involved with strategic planning with the organization. It's good to have them in. I would say have an external partner who is involved as well as in that after action meeting. So if you did an exercise where you invited EMS, have that EMS personnel there. I think it's really going to be dependent upon the players that were involved and some of your leadership that's there. There's no fast and hard rule for this. The other thing which folks may not realize is you might be part of an enterprise. You might be part of a larger umbrella organization, and there could be a process from a corporate side of it. So you may want to make sure your corporate people are involved because it might kind of involve a corporate policy change. So if you're going to make a change at your organization at the ground level, that could be a conflict with your corporate your corporate entity. So make sure that they are involved as well.
I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation or the certificate of continuing education, please feel free to direct any inquiries to Shelley Mixel at shmixell@pa.gov. Thank you, David, very much. This concludes our webinar.